Cancer can be a frightening word to hear. Many of us have been touched by it in some way, a family member, a friend, our own health journey. But understanding what cancer is can be the first step in facing it with clarity and hope instead of fear. Think of your body as a massive city made of trillions of tiny building blocks called cells. These cells have specific jobs. They grow, divide to make new cells, and die when they get old or damaged. This is a normal, orderly process that keeps your body healthy and functioning just as it should, day in and day out. Sometimes, however, this orderly process breaks down. A cell can change or mutate, and it stops following the rules. It starts to divide and multiply without any control, ignoring the signals to stop. These abnormal cells don't die when they are supposed to. Instead, they just keep making more and more copies of themselves, creating a chaotic and disorganized group. Normal cells divide in an orderly way, contrasted with cancer cells dividing chaotically. This collection of out-of-control cells is what we call cancer. It's not a single disease, but rather a large family of diseases that can start in almost any part of the body: skin, lungs, blood. These rogue cells can form a lump or a mass, which is known as a tumor. The purpose of this discussion is to demystify cancer. Knowledge is a powerful tool. When a doctor diagnoses cancer, one of the first things they do is determine its stage. Staging is a way for doctors to describe how much cancer is in the body and where it is located. Think of it like a map that shows the cancer's journey. It helps the medical team understand how serious the cancer is and choose the best possible treatment plan. The staging system provides a common language for doctors. It is usually described with numbers: stage 0, stage 1, stage 2, stage 3, stage 4. Stage 0 is the very earliest form. At this point, the cancer is described as in situ, in its original place. There are abnormal cells, but they have not spread into nearby tissue. They are confined to the top layer of cells where they started. This is often the best-case scenario. Treatment at this stage is often highly successful. Sometimes simply removing the small area is enough. As we move to stage 1, the cancer is a bit more developed. A small tumor or group of cancer cells has formed. It is still localized, not grown deeply into surrounding tissues. It has not spread to lymph nodes or other parts of the body. Lymph nodes are small, bean-shaped glands in your immune system. They are often the first place cancer spreads to. Stages 2 and 3 are more advanced conditions. The tumor is typically larger and has grown more deeply into surrounding tissue. Finally, stage 4 is the most advanced stage. The cancer has metastasized and spread to distant organs or tissues: liver, lungs, bones. It is important to remember that cancer is not a single entity but a broad term for many different diseases. Cancers are often named after the organ or cell where they begin. Understanding these main categories helps. One of the most common categories is carcinoma. Carcinomas start in the skin, or in tissues that line internal organs. Example organ, liver. Example organ, kidneys. Also, lung cancer, and breast cancer. Carcinomas account for the vast majority of cancer diagnoses worldwide. Another major type is sarcoma. Sarcomas form in connective tissues. These tissues support and connect body parts: bone, cartilage, fat, muscle, blood vessels. Bone sarcoma equals cancer starting in bone. Soft tissue sarcoma equals cancer starting in muscle. Sarcomas are much rarer than carcinomas. They can occur in children and adults. Leukemia affects the blood. It doesn't form solid tumors like carcinomas or sarcomas. It starts in bone marrow, the blood-forming tissue inside bones. Bone marrow produces abnormal white blood cells. These abnormal cells crowd out healthy red blood cells, healthy white blood cells, platelets. Finally, lymphomas and myelomas. They begin in immune system cells. Lymphoma affects the lymphatic system, lymph nodes, spleen, thymus gland. One of the most common questions people have is, what causes cancer? The answer is complex because there isn't just one single cause. Cancer develops from a combination of factors. At its core, cancer is caused by changes or mutations to the DNA within our cells. DNA is like the instruction manual for our cells. When this manual gets damaged, instructions can become scrambled, leading to uncontrolled cell growth. These DNA changes can happen for many different reasons throughout our lives. Some risk factors are related to lifestyle and the environment around us. For example, using tobacco is one of the single biggest causes of cancer. The chemicals in cigarette smoke can directly damage the DNA in our cells, leading to cancers of the lung, mouth, throat, and many other organs. Similarly, too much exposure to ultraviolet radiation from the sun or tanning beds can damage the DNA in our skin cells, increasing the risk of skin cancer. Other environmental factors include exposure to certain chemicals like asbestos or infections with specific viruses. Our diet and physical activity levels also play a significant role. A diet that is high in processed meats and low in fruits and vegetables can contribute to the development of certain cancers, particularly colorectal cancer. Being overweight or obese also increases the risk for several types of cancer, including breast, colon, and kidney cancer. Our bodies often send us signals when something is not right. While many of these signs can be caused by less serious conditions, it is important to be aware of them. Paying attention to persistent and unexplained changes in your body can lead to an earlier cancer diagnosis, which often means more effective treatment. One of the most well-known warning signs is a lump or thickening in the breast or another part of the body. While not all lumps are cancerous, any new lump or a lump that is changing in size should always be checked by a doctor to be safe. Changes in your skin are another important signal to watch for. This is particularly true for moles. A. Asymmetry. B. Border, uneven borders. C. Color, multiple colors. D. Diameter, anything larger than a pencil eraser. E. Evolving, any change in size, shape, or color. Beyond moles, a sore that does not heal on your skin should be evaluated. A sore in your mouth that won't heal should also be evaluated. Unexplained changes in your body's habits can also be a red flag. For example, a nagging cough that just won't go away could be a symptom of lung cancer. Hoarseness that won't go away could be a symptom of throat cancer. A significant change in bowel habits should not be ignored. A significant change in bladder habits should not be ignored. Persistent diarrhea, constipation, blood in your stool, blood in your urine. These symptoms could be related to colorectal or bladder cancer. If they last more than a few weeks, seek medical advice. Other general symptoms: unexplained weight loss, persistent and extreme fatigue, pain with no clear cause that does not go away, fever, night sweats, unusual bleeding or discharge. The key is to know what is normal for your body. If you notice a change that is new, persistent, and unexplained, don't wait. Make an appointment to talk with your doctor about your concerns. While not all cancers can be prevented, we have a tremendous amount of power to lower our risk through the choices we make every day. Adopting a healthier lifestyle is like building a shield for your body. One of the most impactful decisions you can make is to avoid all forms of tobacco. If you smoke, quitting is the single best thing you can do for your health. If you don't smoke, never start. Avoiding secondhand smoke is also crucial, as it contains the same harmful chemicals. This one step alone can dramatically reduce your risk for many different types of cancer, not just lung cancer. Protecting your skin from the sun is another simple yet powerful prevention strategy. The sun's ultraviolet rays are a leading cause of skin cancer. You can protect yourself by seeking shade, especially during the middle of the day when the sun is strongest. Wear protective clothing, including a wide-brimmed hat and sunglasses that block UV rays, and of course use a broad-spectrum sunscreen with an SPF of 30 or higher on all exposed skin, even on cloudy days. It is also very important to avoid indoor tanning beds, which expose your skin to concentrated doses of harmful UV radiation. What you eat and how much you move also make a big difference. Aim for a diet rich in fruits, vegetables, whole grains. These foods are packed with vitamins, minerals, and antioxidants that can help protect your cells from damage. Try to limit your intake of processed foods, sugary drinks, and red and processed meats. Combining a healthy diet with regular physical activity is a winning combination. Aim for at least 30 minutes of moderate exercise, like a brisk walk, most days of the week. When someone is diagnosed with cancer, their medical team will create a treatment plan tailored specifically to them. This plan depends on many factors: type of the cancer, stage of the cancer, person's overall health. The goal of treatment might be to cure the cancer, control it, and keep it from spreading, ease the symptoms it is causing. Often, a combination of different treatments is used to fight the cancer from multiple angles. It's a team effort. Doctors, nurses, other specialists working together for the patient's well-being. One of the most common treatments for cancer is surgery. The goal of surgery is to physically remove the cancerous tumor from the body. For many early-stage cancers that are contained in one area, surgery alone can sometimes be enough to cure the disease. A surgeon will remove the tumor along with a small margin of healthy tissue around it to make sure all the cancer cells are gone. Surgery can also be used to diagnose cancer through a biopsy, to determine its stage, or to relieve symptoms caused by a tumor pressing on an organ. Another cornerstone of cancer treatment is radiation therapy. This treatment uses high-energy rays, like X-rays, to kill cancer cells or stop them from growing and dividing. Radiation can be delivered from a machine outside the body, external beam radiation, or it can come from radioactive material placed inside the body near the cancer cells, internal radiation, or brachytherapy. Chemotherapy is a treatment that uses powerful drugs to kill cancer cells. These drugs are often given through an IV into a vein, or sometimes as pills. Because the drugs travel throughout the entire body in the bloodstream, chemotherapy is considered a systemic treatment. Newer treatments like targeted therapy and immunotherapy are also changing the landscape, offering more precise ways to attack cancer cells while causing less harm to the body. The journey with cancer does not end on the last day of treatment. Life after cancer, often called survivorship, is a new and ongoing phase that comes with its own unique set of joys and challenges. For many, finishing treatment is a moment of immense relief and celebration. It marks a major milestone in a difficult journey. However, it can also be a time of uncertainty. Patients may worry about the cancer returning and they have to adjust to a new normal. This new reality might include physical changes, emotional hurdles, and a different perspective on life. Physically, the effects of cancer and its treatment can linger for months or even years. Some people may experience long-term side effects like fatigue, pain, or nerve problems. It is incredibly important for survivors to continue with follow-up care. These appointments allow the medical team to watch for any signs of the cancer coming back, as well as to manage any lasting side effects from treatment. This is also a time to focus on rebuilding strength and wellness through good nutrition, gentle exercise, and getting enough rest. The body has been through a major battle, and recovery takes time and patience. The emotional and mental impact of a cancer diagnosis can be just as significant as the physical one. It's common for survivors to feel a mix of emotions, including gratitude, anxiety, and even guilt. This is why emotional support is so critical. Talking with family, friends, or a mental health professional can provide a safe space to process these complex feelings. Many people also find great comfort in support groups, where they can connect with other survivors who truly understand what they have been through. Living beyond cancer is about more than just being free of disease. It's about navigating the path forward, embracing health and wellness in body and mind, and finding a sense of peace and purpose in the life that follows. Navigating the world of cancer can feel overwhelming, but it is a journey you do not have to take in darkness. By breaking down the complexities of this disease into simple, understandable pieces, we replace fear with facts and anxiety with action. We have talked about what cancer is, a disease of our own cells, and how doctors map its journey through staging. We've explored the main types, carcinomas, leukemias, and looked at the combination of factors that can cause it: lifestyle, environment, genetics. This knowledge is not meant to scare you, but to empower you. We have also discussed the importance of listening to your body and recognizing the warning signs that might signal a problem. Knowing what to look for, like a persistent cough, an unusual lump, gives you the power to act early, and we know that early detection saves lives. We've also seen that we hold a great deal of power in our own hands through prevention. Not smoking, eating a balanced diet, staying active, protecting our skin from the sun. These are not drastic measures, but small, consistent steps toward a healthier life. The landscape of cancer treatment is a place of incredible innovation and hope. Traditional pillars, surgery, radiation, chemotherapy, exciting frontiers, targeted therapy, immunotherapy. Doctors have more tools than ever to fight this disease. The progress being made in labs and clinics around the world is nothing short of remarkable. More people are living longer and better lives after a cancer diagnosis than at any other time in history. In the end, the most important message is one of hope. A cancer diagnosis is not a final chapter. For millions, it is the beginning of a new one.